Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
A person's walking through long grass. They feel a sharp prick on the ankle, and there's no obvious fang marks, no pain, no swelling. So surely it can't be a snake bite. Well, actually, it still could be. In a previous episode, we've talked about Australian snakes, we've talked about the pressure mobilisation technique and managements, but what if you didn't see the snake? What signs and symptoms might tell you that a venomous snake bite has occurred? The first thing to remember is this. Australian snake bites are often surprisingly painless, and many patients have little or no visible injury, sign of bite marks. But you might see them. 2 fang marks, a single puncture mark, or even just a scratch. Or sometimes nothing obvious at all. Unlike many overseas snake bites, redness, bruising, swelling around the bite site are usually minimal. So what symptoms might make you suspicious? The patient may complain of headache, nausea or vomiting, abdominal pain, blurred or double vision, drooping eyelids. Then they may develop difficulty speaking, swallowing or breathing. You might notice swollen lymph glands in the groin or armpit on the same side as the bite. As the venom affects the central nervous system, the patient can develop weakness, paralysis, or even breathing problems. And here's the real important part. The most common cause of death from a snake bite is sudden collapse and cardiac arrest. Now, this occurs usually within the first 10 to 60 minutes after an envenomation. It often happens before the patient reaches the hospital. So, if the patient collapses, becomes unconscious, and not breathing normally, call an ambulance, start CPR immediately, and use the AED if available. There's also an important clue with brown snakes. Some patients experience sudden collapse, confusion, or feeling unwell shortly after the bite, and then they appear to recover. They feel better, everyone relaxes, but this temporary improvement may be the only sign of serious envenomation. That information can be critical for a treating team when considering anti-venom, because snake bites don't always look dramatic. Sometimes there's no pain, no swelling, no obvious wounds. But if the story fits, the history of what's happened fits, and the symptoms appear, treat it seriously. Treat it as if it is a snake bite. Because with Australian snakes, what you can't see can sometimes hurt you the most.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.
Welcome to your daily